Welcome to another clinical case review by your host, Dr. Chris Brown, going in on a case of neck, jaw, shoulder pain, and how that related with upper cervical chiropractic and how it went. This lady, she came to me, actually it was in my first year of practice, and she was coming in with about at least, on her history, I have it pulled up on my computer, so if you look at me, looking at it a little bit, but it says, describe when this problem began, and she says, had it for at least 20 years. She's had neck, shoulder, jaw pain for at least 20 years. She describes it as seizing and spasming at times, and the way that she said that she had felt disconnected from her shoulders up and her shoulders down, almost as if like she didn't have any awareness of the rest of her body beyond her shoulders and the pain in her shoulders and neck. She had been having this constant. It was worsening. She was having it every single day. No meds worked. She rated it at like a 8 to 9 out of 10 for all of them. And I mean, having that for 20 years, that sounds rough. I do not believe she had tried full spine chiropractic before. I think she tried like massages and acupuncture. But really just, and PT, but nothing really helped. And when I took my initial scan of her, her initial scans were rough, I remember. They were super wavy. When I say scans, I mean nervous system scans. I have to catch myself every once in a while because I have to imagine this might be the first video that you're watching relative to me, and so I need to kind of treat every video like it's a baseline. So when people come into us for upper cervical care, what they're seeking, they're truly seeking a long-lasting result and looking to get to the root of their issues, which is what we're looking to address. And we look at things more from a functional perspective of the nervous system, not a structural perspective of the body itself. And more oftentimes when people come to us, they will have had X-rays, MRIs done, CT scans, EKGs, blood work to explain what they have going on, whether it's actual muscle pain or neck or lower back pain, or whether it's something more like idiopathic or unknown in nature, such as migraines or autoimmune conditions or neuropathies. And more than likely, these tests will come back normal, and the doctor just tells them, you're all good, we don't know what to do, good luck. For us, we're like, that's not okay. And when we hear that stuff has been going on for over 20 years, that really tells us that more than likely there's a functional issue underlying everything that's typically rooted in the nervous system. And so it's super important to be able to test for the function of the nervous system, to be able to actually get insight into how well someone's system is functioning, which determines how well someone's system is able to effectively deal with everyday stressors, which is essentially how our body is able to heal, recover, adapt from every day in, day out, essentially. So a super brief overview, less than 1 minute. How does the nervous system work? 4 principles. A, our body can heal itself. Healing codes are created by our brain, communicated through nerves that go to every single cell, tissue, muscle, organ in the body, thus making brain-body communication of the utmost importance, especially this transition site, which that transition site are these top 2 bones of the neck. If there's anything interfering with that brain-to-body communication transition, aka the top 2 bones of the neck, then those healing codes from our brain will essentially get stuck and stagnate up in our brain and skull, and won't be able to get out to the rest of our body, and thus our body will essentially almost suffocate from it, almost as if you kink a hose, and instead of it being an open flow, it's just a drip, a drizzle out. And so if that occurs, then over time, what will happen is that we will start having symptoms presenting as chronic health issues that aren't responding to traditional medicine and care. So this woman in this scenario, neck, shoulder, jaw pain, 20 years, nothing had worked. She also had high blood pressure. She also had heat cold intolerance. She also had unexplained weakness, anxiety, depression, and food intolerances. She took a ton of meds. She had like insomnia, sleep issues, allergies, the high blood pressure, like I mentioned, the anxiety, depression, pain meds. I mean, she had one of the longest lists of medications I have seen in practice so far. And we took the scans, did her initial scans. Scans showed there was interference of her nervous system, was not functioning at the best that it could, which led me to be able to say, we can help, we know what's going on. When we have scans that show that there are interference with the nervous system, what that is, especially for his neck, shoulder, jaw, how that might be connected. When those scans are wavy like that, and they show signs of stress, what they're saying is that there's a misalignment of these two bones of the neck. And we don't know at that time what that misalignment is. We can confirm that on x-rays. And so through our exam process, we're now trying to compile a story that tells us what is unique to you, your unique misalignment. There are 276 different ways these can misalign, which is pretty crazy. And we're trying to figure out the one that will pocket all the balls and essentially be a hole-in-one concept unique to this person. And more than likely, that person will end up having combinations of misalignments where they can rotate one way, they don't move a certain way, and it can produce a lot of chronic health issues if left unattended and unaware. So when we took x-rays of her, I remember it was her left top bone on the left that was rotated kind of backwards is the lay term, but posterior. So rotated basically like this. So hers is rotated like that. Actually, yeah, it was rotated like that. And then also her second bone was rotated this way. So she had this bone was going this way, this bone was going this way. And initially that top bone on the left really was not moving terribly well. So I adjusted that one first for her first, I think, 6 visits. And that was a really great, she was my second patient in practice, and she didn't trend the way that I had hoped or anticipated. And it didn't really get worse, but it just wasn't starting to kind of kick off. And care itself is not a linear process like this. It's very here because we're working with nerves. We're trying to allow nerves to heal, and nerves take about 6 months to heal. It's not like a broken bone that takes 6 weeks or a torn ligament that can take 3 months, 12 weeks. It's a nerve issue, and that takes a lot of time to heal from the inside out. So I remember at her reeval, she had kind of stagnated in care. The marker we looked to hit at our first re-exam, which is in the first 6 weeks, we looked to hit about a 50% improvement within 6 weeks. And we get 80% of people report that metric. She didn't, and that was my first time where I was like, shoot, like scans are looking okay, but what's the holdup here? And so I switched listings. I actually switched to that second bone on the right after reevaluating, and from there care just took off. So it wasn't to say that that first one was incorrect. It was just it wasn't pocketing the whole picture. That's why those motion films, x-rays that we take that will show all the possible misalignments are so critical, because you might be getting a piece of it, but we need to be getting the whole concept. That's what that's what I'm being a doctor of, is being able to get the entire picture, not just one tiny piece. So when I switched to this second bone on the right, that was able to restore motion that way and also address this joint on the left. I remember I also had to lower the table down for her to make a table accommodation because she had left-sided translation. So I was adjusting her right to left, which I had to change the table to basically take that translation out of the way. That might be a little bit too technical for who's watching this. I might have just gone a little bit too doctory, but she stopped having the super bad neck tension and shoulder and jaw issues. But the coolest part that I remember about that case and that person was that she was like, I feel like I'm connected to the rest of my body again. And she had spent the past 20 years being disconnected from her body. So for her to say that, like, for the first time in 2 decades, I'm starting to be aware of what's going on in the rest of my body. I don't feel like I'm just cut off at the shoulders. That was a really awesome testimony to care, because she's the one that's doing the healing. It's not me. It's her body that's doing the work. I'm just checking and monitoring whether or not her body is in a position to continue to function and regulate itself. Like these scans we do every single visit. If we adjust, we do them post-scan too, because we want to verify whether or not we made a proper correction. So with her, every single visit we're scanning. Every single patient we scan every visit. Every single adjustment we do a pre and post scan. At re-exams we do full spine scans, because we're trying to not just clear the neck, but we're trying to restore function from the top of the nervous system, top of the spine, all the way down to the lower back. We're trying to address that whole thing. And by the end of care, she had resolution of her main complaint. And the main thing that she wanted to do, she just wanted to be active. And she got into jazz dance, which was really cool. She got into jazz dance and Pilates and gardening. And she hadn't been able to do that before because of how much tension and torsion was on her neck. And when you start getting rotational components involved in the upper neck, that's a very common thing that I've been seeing, is that they will oftentimes almost like spasming, twisting, one side super tight, they can't turn that well. And that can be a very common thing when these two bones start getting rotated the way that they are. So with that was a really cool case of, just kind of a learning experience for me, not being afraid to switch. It wasn't to say that that the first plan of attack wasn't the correct one, but there's a better way to go about it. And that's one reason why I really like this work, is that you have to be humble enough to acknowledge, like, hey, I think there's a better way. Let me recheck and see if there's a better avenue for you, because I think that there is. And we were able to figure that one out, and she did great with care, continues to get checked every 2 months or so, just being checked for a cavity, essentially. That's kind of what we want to head towards, is we want to be able to just say, like, hey, like, let's get in, see if, same thing as a dentist, check to see if there's a cavity. That's about it. And if we're able to maintain that, then we're able to have that prolonged health span that we're all looking for. None of us want to live a sick life. None of us at the end of our life want to look back and be like, dang, like there's a lot more I wish I did. I wish I felt better during it. I wish I was healthier during it. None of us want to be in that position. And the best thing to help with that is upper cervical chiropractic, hands down. I will die saying that on my grave. That will be on my gravestone. The best thing for you and your health and your family and your friends is upper cervical chiropractic. 100%. Thank you.